Hello, Maryland peers. Welcome to the Mentoring and Education webinar for Peer Recovery Specialists, brought to you by Voices of Hope, which is a peer-run recovery community organization, nonprofit, that serves Cecil and Hartford counties in Maryland, but also is invested in helping peers across the state become certified. So at the completion of this webinar, you'll take a post-test, and then if you pass that post-test with 80% more correct, you will get a completion certificate in your email. That CEU is approved by the Maryland Addiction and Behavioral Health Professional Certification Board that runs the credentialing process for peers in Maryland. So first, let's make sure we're all operating on the same base of knowledge about the Certified Peer Recovery Specialist credential in Maryland. So in Maryland, the Certified Peer Recovery Specialist credential encompasses substance use and mental health recovery under the all-inclusive title of behavioral health. So people who are certified peers in Maryland are expected to be able to provide recovery supports to people with behavioral health conditions, whether that is mental health or substance use or both. So the credential follows 4 domains: advocacy, mentoring and education, ethical responsibility, recovery, and wellness. So this is going to be under the mentoring and education domain. 500 hours in the role of a peer is also required to become certified, and you'll need 25 hours of supervision by a registered peer supervisor. Registered peer supervisors are on the Maryland Addiction and Behavioral Health Professional Certification Board's website. Hopefully your organization has a registered peer supervisor or RPS on staff. If not, please reach out to Voices of Hope or MPAC, Maryland Peer Advisory Council, to get support in finding a volunteer role for you to become a peer, or to connect with your organization to support them in your goal of being certified. So the registered peer supervisor has to supervise the work that you're doing as a peer recovery specialist. They must be able to process the 4 domains with you in your work, and also talk with you about self-care. In order to be certified, you'll need to have 2 years of verifiable sustained recovery to apply, and that is recovery from substance use, mental health, or be a family member. So why is mentoring and education so important in the work of a peer recovery specialist? Well, we are people in recovery, and we model and mentor people who are in recovery, either trying to get into recovery or they are in recovery. So we are mentors, and education is about, providing information to people who are in recovery on how to overcome stigma, how to connect to resources, and how to improve their lives. So we're going to go more into that in this webinar, but I also need to let you know that the exam that you take at the end of all your training, your 500 hours in the role, your 25 hours supervision, sending in your transcript, to do all these things, and there's a webinar on our website that tells you about all the parts and pieces of the credential. But then you have to take an exam, and the weight on the ICNRC exam is 22.5%, which means that all the questions that are going to be on your exam, 22.5% of them are going to be in this domain. So we want to make sure that you are trained up and ready for that. And the associated job tasks, which is from the ICNRC organization that monitors our exams and certifies us, the job tasks, which means these are the things that are going to be expected of you to be able to do as a result of your credential, that fall into mentoring and education domain. We are going to serve as a role model for an individual. We're going to be able to educate others through shared experiences the things that we have in common, and talking about the things that we've lived through and the things that we've overcome and how. You're expected to be able to establish and maintain a peer relationship rather than a hierarchical relationship, which means you'll need to know what that means. And we're going to go into that a little more. You'll have to be able to assist an individual in identifying and establishing positive relationships. So you'll have to know what that even means. What's a healthy relationship? And how can you tell, what they are and what they're not, and help somebody else to identify it. You'll have to be able to support the development of healthy behavior that is based on choice, not imposed on somebody, but, inspiring and helping people to improve their own lives themselves. So we're also expected to establish a respectful and trusting relationship with the individual that we serve. So what does that look like? What does that mean beyond just feeling that you have respect and trust somebody, or you want somebody to do that for you? It looks like some things, and we're going to talk about that. You'll have to be able to recognize the importance of self-care and be able to tell the person that you're working with how important it is, and which falls into the next item of you'll need to be able to describe the skills needed to self-advocate. And that's not all. The list continues. You'll have to be able to demonstrate consistency by supporting individuals during ordinary and extraordinary times. To be able to support the development of effective communication skills. To support the development of conflict resolution skills and problem-solving skills. So in order to support the development of that in the people that we're working with, we have to make sure that our own skills have been developed, or at least know how to develop them. And then we'll be able to teach somebody else through mentoring and education how to do that for themselves. You'll have to know and apply the principles of empowerment, and provide resource linkage to community supports and professional services. And that's a lot that falls into that education domain, part of the domain. We have to know the resources and be able to effectively connect people to those resources in an effective way. So when we talk about mentoring and education as a peer recovery specialist, it all starts with you, the peer. How are you doing in your recovery? Are you walking the walk, not just talking the talk? Do you have a recovery plan? What is your pathway of recovery? Because if it's just a shell of truth, then people see through that. So we want to make sure that people who are certified peer recovery specialists are truly in recovery, that they can talk about their process of change through which you have improved your life, your health, your wellness, to live a self-directed life and can strive to reach your full potential. So that is the definition of recovery from SAMHSA, which is the Substance Abuse Mental Health Services Administration, or the Feds. That's their definition of recovery, and we follow that definition in Maryland under the Certified Peer Recovery Specialist. So if recovery is a process of change through which you've improved your health and wellness and live a self-directed life and strive to reach your full potential, you have to be able to talk about that, to mentor that, to show that, and hopefully through the trainings that are provided for this certification in Maryland, you'll be empowered to do that. Because peers are the role model. We are the mentor, the example, and the wellspring of hope. We bring the confident expectations that things can get better for everyone. So what makes peers so great is that we are equal to the people that we serve. And that is unique in the healthcare profession, where we're used to like doctors and directors, nurses, counselors, that all have a level of power. And as peers, our recovery is equal. We've been there. We can help people see the path ahead and support them and show them that it can be done. We did it, right? but in all actuality, peers do have power in these positions. It's important for you to recognize that power going in. So, especially like if you work in the jail or with a, correctional facility, even hospitals, treatment programs, and homeless shelters and human service providers. Peers know and have relationships with the people who have power in these organizations. Those people who can, uh, you know, break parole, probation, kick somebody out of treatment. Peers can be the difference between somebody having shelter that night and being kicked out into the cold just because of the power we have to advocate in those organizations. So it's important to recognize and acknowledge that power that we hold. The people that we serve, they see the power. It's important for you to know that you have power, even though you may not feel it. It's there, and we can come up with strategies on how to overcome that barrier of power, not by breaking rules or sideswiping some things, but by working within the system and having techniques that can be given to us by our coworkers and our supervisors at our organization to kind of level that playing field a little bit. But even leveled, there is still an element of power that you have. But we can use our power for good. Okay, so when you see one of these cool lighthouses, that means we're getting ready to go over a sample exam question for the Certified Peer Recovery Specialist credential. And going along the topic of peers having power, we're going to ask, so you reduce relationship rapport with a peer by, now relationship rapport means an easy conversation back and forth. It's just kind of relaxed and going back and forth. So how do you reduce that? Is it by being unaware of your power, creating a sense of belonging, being authentic, or promoting trust? So how do you think you reduce the ability of having an easy conversation with the person you're working with? Which one do you think? Well, the answer is one, being unaware of your power. And, some ways peers may create barriers for connections, including telling, ordering or directing, cautioning, lecturing, and not being aware of personal power in a peer relationship. So if you catch yourself telling somebody what to do, ordering them to do something, cautioning them or lecturing, then that is, being unaware of your power. Maybe you think that is okay to do, and hopefully you'll get enough trainings to know that no, we're going to walk with people and have them make their own decisions and support them along the way. And the personal power that I have over that person, they might just go along with it, being like, yeah, because if I don't just say, do what they're telling me, I'm going to get in trouble. So that's being unaware of your power. But that is going to be, it may be one of the questions on your exam. So peers are expected to be role models of what healthy relationships look like. What are the qualities of healthy relationships? How do you become a person, or what qualities are in people that set the stage for having healthy relationships? But characteristics of healthy relationships are, being honest, being a truth teller, even when it's uncomfortable, even when it might be difficult. It's, being dependable, being where I'm at, where I say I'm going to be, showing up and being transparent about my role and what I'm doing here, what are my motives, demonstrating respect, not just for the person that we serve, but people, our co-workers, the general public, showing what respect looks like for all people. These are setting the stage of having healthy relationships with other people. Showing empathy, not being dismissive of somebody's feelings, being trustworthy, to establish trust. So what does trustworthy mean? I can be a confidant, but an honest one where I don't keep secrets, but demonstrating that I'm trustworthy and that I give people trust. Open communication, meeting people where they're at to speak to me, or in the way that they want, how they want. You know, there's nothing hidden in my conversation with you. I'm very upfront, and I have a willingness to meet people where they're at. I care about people, and I'm willing to show that. And having and maintaining boundaries in relationships. So we become role models of healthy relationships with the peer that we're working with. They watch us as we demonstrate that with other people in our organization, in the recovery community. And what might prevent you from modeling or having a healthy relationship with a peer you're working with? So I want you to think about that, and uh, what could possibly prevent you from having a healthy relationship? And you know bring that up with your supervisor. Talk that out, because I bet you it's something that can be overcome. So here's that lighthouse again. Let's go over a sample CPRS exam question. A way for you to show empathy is by 1. Talking often, 2. Responding quickly, 3. Working to understand another's feelings, and 4. Listening but not responding. So which one of these do you think is a way that we can show empathy in our relationship with our peer? Answer is 3. Bet you a lot of you guys got that. So some functions of empathy are to build relationships, increase communication, and show the ability to understand and share another person's feelings. Some barriers that interfere with showing empathy may include talking too much. Some of us may do that when we're nervous. We talk too much and then we're not listening. Interrupting when a person is talking to insert my views or opinions, and not responding or letting the person know that I'm listening. So you will have opportunities to learn about active listening skills. And a general rule of thumb when working with somebody is the 80-20 rule. The person that we're working with should be speaking 80% of the time, and we should be speaking 20% of the time. A lot of the work that peers do is just giving space to people to be heard. And in order to be heard and feel heard, we have to practice active listening skills, like eye contact for most people, nodding appropriately, asking questions that are not yes or no answers, that just kind of tell me more questions, and then really trying to be engaged with that person that we're working with. So when we talked about healthy relationships, we listed trust as one of the characteristics. How do you build trust with somebody that you just met, or you know them for a while but you're not really engaged with them, or somebody that you really need to get in there with and try to help them in their recovery? So in your experience, what does one need to do to begin to trust somebody? What do you need in order to trust somebody else? Think about that. And then think about what actions demonstrate those things. Because feelings are feelings, and they're hard to see and demonstrate. So it's important that we learn the characteristics of what building trust looks like. And here's some easy ones. Just by being honest with somebody, not brutally honest, but compassionately honest. We have to be truth tellers even when the truth hurts. That we're dependable. We do what we say, and we show up. We don't promise things that we can't deliver. We practice empathy with the person, and we are advocates. We walk and work alongside somebody to help them speak up for themselves, and kind of like a cheerleader. We practice loyalty with the person. What does loyalty look like? It means not talking about them behind their back or saying things in sarcasm, that's for sure. So being fair with not just them, but with everybody else that we might be serving, and people are watching us to see if, uh, we're being fair to everyone. And having those boundaries. People can trust us if they know what our role is and that we protect those boundaries. And what else do you think? So when we talk about boundaries, these are super important in the peer world. And a lot of people throw the word around, but what does it actually mean? And, it's not just in this work, but all people need healthy boundaries. And we model how to have boundaries and how to be clear yet sensitive while maintaining them. Concrete boundaries for certified peer recovery specialists are that we are truth tellers, like I said before, but we can tell the truth gently because it may hurt. We don't exchange money, gifts, or services no matter what. Never flirt or date the person that we're working with. And your organization may have clear rules about this, but it's also if they don't have rules. We want to be really mindful of boundaries as a peer recovery specialist with the people that we're serving. We do not give our personal contact information. We must give the agencies. And we don't go against company policy. Even if we don't agree with it, there are ways to advocate for rules to be changed or looked at in a different way for different circumstances, but we don't go against them for anyone. But that being said, you never do something that makes you feel uncomfortable. That's, safety first. If your organization is asking you to do something that makes you feel uncomfortable, you have an obligation to talk it over with your supervisor before doing it. If you do it, it might just cause a bad feeling for you and take you out of this field altogether. So talk it over with your supervisor. But everybody needs boundaries, and the people who need them the most are people who come from situations where there weren't any. And those people are a lot of the people that we serve. So having boundaries, but not being a jerk about it, explaining them is a role model of how they can set up boundaries in their own lives. So here's a great sample CPRS exam question. Enabling can be described as 1. Providing an opportunity for the peer to recover. 2. The well-intended behavior of others. 3. Allowing an individual the opportunity to discuss their mental health and/or addiction history. Or 4. Providing treatment opportunities for those in need. So what do you know about enabling? And what do you think is the best definition here? Well, the answer is 2. Enabling can be described as the well-intended behavior of others. So according to the American Psychological Association, enabling can refer to patterns within close relationships that support any harmful or problematic behavior and make it easier for that behavior to continue. So how do we help people that we work with choose healthy behaviors for themselves? Well, peers celebrate any positive change initiated by the people we're working with. And we can learn how to identify, engage, and encourage positive change through the stages of change model. And here is a diagram of the stages of change model. We're going to go into a little bit of each one of these areas. There are 5 stages of change: pre-contemplation, contemplation, preparation, action, and maintenance. So let's review these stages rather quickly. So in the pre-contemplation or pre-thinking about change, the person does not see the behavior as a problem, does not see a need for change, and has no intention of change. When you talk to somebody and they're like, I don't have a problem, you have a problem, or my family has a problem, but I don't have a problem. This is working out really good for me. I like this. And you'll see people in pre-contemplation stages, even in treatment, when they're in forced situations. They're going through the motions to please the system, but they really don't see any benefit or even a problem. And then people can move on to contemplation stage, where the person has some awareness of the need, desire to change behavior and is actively weighing the pros and cons of the behavior. So, what peers can do to help somebody go from I don't have a problem to maybe I have a problem. I can see how, this behavior is affecting my life in a negative way. Is in pre-contemplation, we don't argue with people, but we can listen to them, engage with them, build relationships, build on honesty and trust and respect as we're engaging with them, and just, raise the case of concern. Like if they have wounds or, have been kicked out, having problems in their relationships, or just concerned about their health. How's that going? How are you doing? Showing that we care. That's the big thing that peers can do for people in pre-contemplation stage. And that actually encourages people to move to the contemplation stage on their own, where by talking about it, maybe making some connections between the negative consequences and their own behaviors, they start to think about it a little bit. So the third stage is preparation, where the person believes that the behavior can be changed and that he or she can manage the change and is taking steps to get ready to make the change. So people in preparation stage are like thinking about treatment, maybe medications, maybe they're trying to think, well, maybe I can limit my use if it's substance use. They are preparing. They're looking at their options. And how a peer recovery specialist can help somebody who is in contemplation stage get to preparation stage is, just, talking about options. What do you think? Asking good questions, which is motivational interviewing, right? Is asking good questions to have people talk it out. People are experts of their own lives, and we want to bring the education and the connections to resources and options of different recovery pathways, different treatment options, just to bring it all on a platter and help them talk through, well, what do you think might work now, might work best for you, and what do you have to do to take that step. And then action phase is when the person actually, signs up for treatment or, is trying to limit their use of drugs or, actually shows up for the appointment. Versus preparation when they're talking about it, they might have even made the appointment but haven't gone. And then action stage, they have taken those next steps to put their plan into action. And what peers can do is bring the resources to help them initiate that action, whether that be help to overcome transportation barriers, get the phone numbers, help to develop the plan if they decide they're going into treatment in a recovery house, what's going to happen with their family, help them talk it through. And then maintenance stage, where the person has gone through the action stage and is now maintaining their new behavior consistently for over 6 months and have made the new behavior habitual. So what peers can do to support people in that stage is just be available. There will be times of crisis where, in troubles and confusion, we know it, we were there too. So having a peer to be there to just talk it out, to be able to reach out to touch base with, is super important. Now, we have listed here the relapse or reoccurrence stage, where the person has a slip or reverts back to a previous pattern of behavior. The person may become discouraged, but should recognize that most people making a behavior change have had some degree of reoccurrence. Because it's not just substance use, abstinence, non-abstinence, not returning back to the drug of choice, but stages of change of like showing up for work, or different behavior changes that we may want to do. Personal health and wellness, like going to the gym, saving money, over some behaviors like obsessive gambling or sex addiction, food addiction. These are all behavioral health situations that we can recover from. So we will have lapses in different areas, and peers are really great with like supporting people through challenges so that we can avoid rehospitalization, incarceration, and even death. By being cheerleaders of like, okay, well, what can we learn, and where can we go from here? So that being said, when a relapse or reoccurrence happens, or some consequences come to get us, what can peers do? Well, we're cheerleaders. We don't give up, on people. And we celebrate the wins, even the small ones, right? With the person that we're with. As long as they're celebrating it, we'll celebrate it with them. And we don't give shame or judgment. We just keep moving. And there may be consequences to relapse and reoccurrence, or a poor behavior choice that somebody made on their own free will. But, we can walk with them, with our peer. Because we give second chances, third ones, 51s, or more, right? Peers are not attached to the success, a personal success someone's having in their journey. We're just there to help walk with them, to encourage them, to give options and education, and mentor people. For a lot of us, we didn't get it on the first try. Did you? And if you did, can you help someone that isn't getting it the first, second, or third try? And peers are planting seeds, and their seeds take time to grow. So whether it's a peer that engages somebody on the ACT team, or mobile crisis team, or it's the peer that is seeing them in the emergency room, or the peer that's seeing them in the hospital floor, the peer that is in treatment, inpatient, or the peer in outpatient, or the peer at the Certified Peer Recovery Specialist training program, or the peer at the Recovery Community Center. So we all are planting seeds, and they take time to grow, but if all our seeds are being planted with these values that we share, the fruit will be plentiful for that person and our community. So here's another question for you on a different topic, the topic of stigma. So what do you think stigma can be clearly defined as? 1, the experience of being deeply discredited due to one's undesired differentness. 2, echoes heard from our families and society in general. 3, hidden pockets within our own belief system. 4, persons with mental health and or addiction who do not have a full range of human qualities. So what do you know about stigma? Well, the answer is 1, the experience of being deeply discredited due to one's undesired differentness. So stigma can lead to social exclusion or discrimination, and can discredit a person due to differences which may result in unequal access to resources, including educational opportunities, employment, a supportive community, and access to quality health care. So stigma is one of our biggest challenges that we face in recovery. And peers model how people in recovery handle stigma through advocacy. We have an opportunity to advocate with our peers to be treated with respect and dignity, to protect our rights, especially concerning health care and access to treatment. Peers are expected to respectfully challenge stigma in our community, in our organizations, and with service providers. We challenge it. When we see it, we can identify it. We can talk about how it's preventing people from getting the health care that they deserve, because peers are respected in the community. We have certified ourselves. We treat people with respect and dignity. We're honest, not only to the people we serve, but with all people. And because we're dependable and transparent, we have earned respect in our community, so people will listen to us. So that's some of the power that we have, and that's some of the power that we can use to provide good, to do good, to help others by eliminating stigma. And beware of sarcasm in your organization. It stigmatizes each other. A disrespectful word or phrase can damage relationships and the culture of our organizations and the recovery movement as a whole. We are the role models. So just say what you mean and mean what you say, and try to avoid sarcasm, even if it may be the culture of your organization. So let's talk more about advocacy. What does it mean to advocate? And a simple definition is speaking up on behalf of ourselves or others. When would we need to advocate for ourselves? Well, with healthcare, when we're not getting access to it, maybe our insurance is denied, we don't get timely access, we don't have healthcare options, treatment options, they're very limited. We may need to advocate for ourselves when there are certain medications we do or do not want. When we feel like our doctors are not listening to us, we may need to advocate for our needs, wants, and rights in our employment situation, in our housing, transportation. We may need to advocate for ourselves in relationships, right? To tell people what we need and want, or we feel like we deserve, what is fair, to be free of harm, and et cetera, et cetera, et cetera. And when would we need to advocate for others? Well, same things, if we see that people are not getting access to health care, that their doctors are not listening to them or to us in the recovery community as a whole, if we don't have healthcare options or treatment options in our community, when we see other people's rights are being disregarded, and when people cannot speak up for themselves because of consequences, or they just don't have their voice. And we might need to advocate for others when we see stigma, like that mark of discredit, because of where somebody lives, or their culture, or their drug of choice, or their diagnosis, and they might be discriminated against. That's when we need to step up for advocacy. So we can't talk about advocacy without talking about self-advocacy. And that means, advocating for myself and teaching people and showing people how to advocate for themselves. And the biggest way that we can mentor self-advocacy is maintaining our own boundaries, sticking up for ourselves in a respectful way, not backing down if somebody's pushing into my boundaries, but not being a jerk about it either. And when we respect other people's boundaries and how they want people to treat them and the rules of our organization, and when we do that, we show people how to do that. But there's also some other things that we can do to advocate for ourselves, whether that's writing letters to politicians and people who make the decisions in our lives. We can write letters to advocate on our behalf, or we can attend meetings and appointments together. So sometimes if I just attend a doctor's appointment with someone, not speaking up for them, but just being there to give somebody some courage to speak their truth, that's something that we can do together for advocacy. And we can practice role playing. Like if someone needs to go in front of the judge or talk to their doctor or advocate to their recovery house manager, we can do some role playing on how that looks, and to build up people's self-efficacy, their self-esteem, their confidence, and that helps people advocate on their own behalf. But if you are in a position to advocate for someone who's not there with you, try to get permission from the peer to speak on their behalf, if possible. Sometimes peers are in clinical team meetings. Sometimes we're asked by our organization's management about them. It's really good practice to at least try to touch base with that peer and let them know that you're going to be in that situation and what would they like you to do. And when you have control, invite them to that meeting. But making sure that we're getting direction and approval from the person that we're working with to act on their behalf is pretty essential. And we want to encourage our peer to try to speak up for themselves. At all times. And sometimes people want us to do it, right? And sometimes it's high anxiety for them to do it, and you'll have to weigh out those times and see, is it better if I just do this at this time with them, for them, or is this an opportunity for this person to practice their self-advocacy skills? You'll have to use your discernment, your organization's policies, and your own experience to kind of guide you in those situations. So one of the skills and job tasks that are expected of certified peer recovery specialists when it comes to the mentoring and education domain is being able to understand and apply conflict resolution skills. So we have opportunities to mentor conflict resolution skills by walking somebody through the process of maybe what lies underneath feelings, because feelings can really create havoc. I know they have in my own personal recovery. So having somebody there that kind of can ask me questions using motivational interviewing, which is open-ended questions, not a yes or no answer, to help uncover the nature of the conflict that I might be having with something or someone in my life, and helping me figure out, well, what is it really that I want underneath that emotion? What is it that I really want? And maybe even writing it down. What is it that I need? Are my wants and needs the same or different? And what is it that's important to me? What are my values in this conflict? To make sure that I'm living by them, that I can feel good about my part to even understand where this conflict is coming from. And, having that person, the peer, talk to me about the differing viewpoints of that situation, just to kind of talk it through. It's not co-signing it. It's just, expressing respect for the different viewpoints of other people that are involved. That's a good mentoring practice. And we practice as peers active listening to get to the nature of the need or opposing opinion that our person is having. It might even be with us. But after some brainstorming, compromises in the conflict, lots of different options, which ones are the least acceptable and which ones are okay and which ones, the dream come true, talking about them and all the different choices and consequences that may come along with them is good conflict resolution skills. So what our peer decides to do in their conflict, we provide support with implementing the plan. If it's not going to hurt them or other people, we just go for it, trying to figure out. Self-efficacy is me making my own decisions and feeling the consequences so that I can learn how I want to be and what I'm going to do in the next time that I'm in this sort of situation, and not just having someone fix it. As peers, we have to resist the righting reflex. We may know the answer. We may, know what to do exactly to make it right, but it's important to resist that righting reflex to let other people unfold their own experiences in their recovery. And it's okay to have a plan A, and then if this doesn't go right, how do we know it isn't going right? What does it look like? And what's our plan B or even plan C for this conflict resolution? So we can't forget about the education piece of the mentoring and education domain. And I think education refers to just a broad expectation of all peers to be able to provide information and effective linkages to community resources, like multiple pathways of treatment, multiple specialties in counseling. Which ones have you heard are good in the recovery community? Maybe which ones are more trauma-informed, family counseling. What about mediation to resolve conflicts? Do you know where the local nonprofit mediation center is that can work with families and organizations? Where can somebody get food, shelter? How about pathways to education and jobs? How to get signed up for healthcare, how to get a primary care doctor, how to get tested for HIV and hepatitis C and get treatment for those infections, and where can someone get legal advice and representation? There's certain situations that occur in our population more than others. So get to know those connections in your local community, and please don't just rely on 211 or somebody else to give a referral. Try to be the one-stop shop that knows exactly who to contact and how in these areas. So another job task in mentoring and education is the concept of empowerment, right? Understanding the principles of empowerment, to empower the person that we work with to believe that their life can get better as they see fit. And hopefully you feel empowered as a person in recovery in this workforce. But we can look for opportunities for the people that we're working with to speak up for themselves, to make the calls, make their own calls to those resources we were talking about, and to make their own plan. It may take some extra time. With working with somebody, it's so much easier for me to just pick up the phone and call, but a little empowerment can go a long way, because if someone can make those kind of actions for themselves, they can make more of them when you're not around. So we help peers find all the available options and choices, and to make the best one for themselves, what they think, even if you think there might be a better way. We learn and grow by making our own choices. That doesn't mean to say that your experience isn't important, because your experience with some of these resources and pathways are important, and that's what we ask you. I ask you to share your experience, strength, and hope with people. But if they want to choose another way, we're going to support them in that. It might work out for them. We don't want to discount what could work for somebody else, right? We want to cheer them on, and then if it doesn't work out, we're going to still be there for them while they try something else. And we build confidence in ourselves by sharing our story, right? We build confidence in ourselves. Other people hear our stories. They have hope in our stories. Other people have helped us. We're helping other people. It's just kind of how it goes. And in that process, we empower each other to support and grow and change in recovery. And because recovery isn't just like changing my biochemistry, it's a natural, growing process that I want to be engaged in, and it doesn't stop. Just on that first day that I entered treatment, recovery is ever growing, and that is empowering. But also be generous with honest compliments to your peer. We all need encouragement, and that empowers us. And be generous with honest compliments and applesauce. So on your quiz, you will have a question that says the secret word of the webinar is applesauce. So as good mentors, we want to demonstrate taking care of ourselves. So, you know, we have to show people we do it, and then they see us doing it, so they're going to do it too, right? And taking care of yourself is a domain that is gone over with a registered peer supervisor with you. You'll talk about self-care, and I think it's worth leaning into a little deeper all the time, because I think that peers are givers and they will give it all to help someone else. But we need you to take care of yourself, because if you don't take care of yourself, who will take care of you? And if you don't take care of yourself, why should anybody else take care of themselves, right? The people that you're working with. If they see you giving, then chances are they're going to think that's the way to go too. And what would happen to our profession as certified peer recovery specialists if we aren't taking care of ourselves first, if we're just focusing on the people that we're helping, and we don't focus on ourselves? I think that we would crumble. We will all be people who are seeking services, and so we have to maintain our recovery, and we model recovery, and that means we walk the same road as the people that we serve. If you're not in recovery, a peer recovery support specialist is probably not the best option. Maybe being a community health worker or a counselor or something else might work best. But in the certified peer recovery specialist credential, we are people in recovery walking the same road as the people that we're helping. We just might be at different locations at different times on that road. And you have to have 2 years of recovery, verifiable recovery, before you become certified. And I just ask you to not leave that path once you become certified. And sometimes that happens when people focus on other things, like, prestige or position, or, there's some other things that can take us off our path. And for me, at the end of the day, if this career path is in conflict with your recovery, choose your recovery every time. So take time to rest. How much sleep do you need to function well? Maybe get one of the Fitbits and kind of see when you function your best. How much sleep do you need, and are you getting it? It's super important to be well rested. Just as important to take time to play. So play is defined as something that you do where you lose track of time and it doesn't have a purpose. What do you do to play, and how often do you play? Those are some important questions that you should ask yourself, and your registered peer supervisor will be asking you too as you go along in this process. So congratulations, you've completed the Mentoring and Education webinar. Thank you for spending the time with me and listening to me. You can take the post-test and the course evaluation by either clicking this link. If it's not clickable, it will be listed in the Google form. After you pass the test, you will receive your certificate in your email. If you have any questions, there'll be contact information there. Join the Maryland Peer Advisory Council, MPAC. Join it on your Facebook, if you have Facebook, or go to their website and sign up to stay up to date on trainings and advocacy opportunities across the state and the nation. And if you would like to help other people become certified and join the healthcare profession, please donate to Voices of Hope through our website. We have some cool t-shirts on there. We have other classes that you might want to sign up for. If you need support with becoming certified yourself, reach out to us. We'd be glad to help. And thank you. Thank you for the work that you do, and good luck.